Hello and welcome to politicallyunbiased.com. It's Monday, October the 12th, and I'm glad you could join us today. First up is the issue of healthcare, and today there was there's a lot of controversy about a report that came out that said that healthcare cost is going to go up much more than what the CBO has projected. Now, this is a report obviously that was done by the healthcare industry, and it said that by 2019 the typical family premium would cost about $4,000 more than projected by the CBO and by the Congress. Now the the report has been lambasted by liberals and by Democrats, saying that its only purpose is to derail healthcare reform, blah blah blah. Now, it may be the case that the healthcare industry is trying to derail healthcare reform, but I think the basic thrust of the report is accurate, because and I've been hitting this drumbeat now for weeks, but nobody else seemed to buy into it. I've been saying from the day that President Obama made his speech back in September, his speech before Congress on healthcare. From the time I heard the speech, I said that what the president is proposing is going to increase healthcare costs significantly, and that's what this report is saying, that it is going to increase costs. And so the basic thrust of the report is actually true, and it bothers me that the Democrats and liberals in the media just dismisses it as just being another attempt by the healthcare industry to derail healthcare reforms, and not considering the substance of the report. Now, on the day after the president made his speech, I pointed out that the president highlighted three things that no doubt is going to increase costs. The president said that he will require insurance company to cover people with pre-existing conditions. Now, that's a laudable goal. I don't have any argument with that, and it's good if it'll be good for people. It's good for the people who have pre-existing conditions. They're going to be covered. But my point is that it can't be done without increasing the healthcare premium. I mean, if the healthcare companies are going to cover these people who are more expensive, obviously the money is going to have to come from somewhere. They're not going to suddenly decide that they're going to be nice people and they're going to take less profits. They're not going to do that. They're going to have to increase their premiums to cover that expense. I mean, the reason why they're not covering them now is because they don't want to cover them, because it's going to increase the premium, and then the insurance industry is going to be demonized for it. So what I'm saying is that, as desirable as it is that we want to cover people with pre-existing conditions, it's going to be a cost to the healthcare industry, and the way they're going to deal with that is they're going to increase premiums. So the Congress and the CBO and the Democrats and the liberal media, they're not facing reality. They're not facing the facts. They're not facing the reality of basic mathematics. That's what this is about. What bothers me about politicians and people in the media is they have no... Sometimes it seems to me that they don't understand how the real world works. I mean, and they seem to ignore certain basic facts, and they hope that something else is going to happen. No, nothing else is going to happen. If insurance companies have to cover people with pre-existing conditions, and they have to pay more, which means they're going to have to pay out more money, more in reimbursements, where is the money going to come from? It's going to have to come from increasing the premium. So that's why I say this report from the insurance industry is not off base. Now, and that's only one aspect that I've outlined. The second thing the president said he's going to want insurance companies to do is to stop, quote, water down the coverage they provide. Again, a laudable goal, and it's a good thing. But it's going to come at a cost to all of us who have private health insurance, because again, if you require that the insurance companies expand the coverage, if you like, make it stronger and more robust, it's going to increase the amount of money that insurance companies have to pay out. So where are they going to get that money from? Again, they're going to get it from increasing the premiums. That's where it's going to come from. Again, a basic fact of math. It's not, you don't have to be very smart to understand that. Now then the third thing is the president said that night, and basically what the president said is what is in the Senate bill, what the Baucus bill. That's what it is. He says he's going to require a cap on the amount of out-of-pocket expenses that people have to pay, which means that when you cap people's payment, more money is going to have to come from the insurance industry. Again, it's going to increase costs. So taken together, these three things are going to impose a tremendous cost on the insurance companies, and they're going to respond by jacking up their rates.